Hi friends, this is Dr. Sitesh Roy, immunologist, allergist, coming to you with a very special video on facts about coronavirus. What started off in the animal and seafood markets of Wuhan, China has now spread to 80 countries with over 90,000 people infected and over 3,000 dead. By all standards, this would be considered a pandemic, having spread to 6 continents across the world and only the Antarctic to spare. So there are a lot of questions in people's minds about what is the coronavirus, where did it come from, how is it spreading, and what can we do about it. So let's look at some of these facts and recognize this disease. So the coronavirus is a largely zoonotic disease, which means only present in animals, which once in a while, maybe once in a decade, skips from animals to humans, and the key for that is consumption of certain types of meat, in this case bat meat and snake meat. And from there what began then leads to human transmission, and this is a highly infectious, very rapidly spreading virus by all means. What we know about it is that the human transmission affects on an average most people who are exposed to it up to about 20 to 30%. It's largely transmitted by droplets, which means sneezing and coughing. It's also transmitted by contact with surfaces such as doorknobs, tables, commonplace areas where we may touch and then touch our eyes or nose or mouth. With these kind of changes, the symptoms that typically come up for a person can have an average incubation period where they are asymptomatic between 2 to 4 days. However, the longest incubation period seen so far has ranged between 14 to 24 days for this version of coronavirus, which is called COVID-19 by the World Health Organization. After that kind of an incubation period, the typical symptoms, which is the most important thing to recognize, is fever, which is present in 50 to 60% patients, and a dry cough, which is present in up to 60 to 70% patients. However, some patients do not demonstrate the fever till they are much further in the disease. The incidence of breathlessness is less than 50%, and the incidence of body pain is also present in about 50% patients. Interestingly, unlike the flu and other respiratory viruses, the incidence of sore throat, runny nose or sneezing is less than 5%. So if these symptoms are present, these will usually divert a person towards looking for non-coronavirus COVID-19 infections. It's also important to recognize that of the infected people, about 82% will have mild to moderate disease, about 13 to 14% will have severe disease, and between 2 to 3% will have critical illness which can even lead to death. Interestingly, large majority of cases that have occurred between the ages of 30 to 80 years, with about 60% males and about 40% females affected. Interestingly, there have been no fatalities between the ages of 0 to 9, though children are not exempt from this disease. Certain groups are considered high risk for this disease, including those with cardiovascular disease, those with diabetes mellitus, those with chronic obstructive pulmonary disease or asthma, those with hypertension, and those with possibly cancer and other immune suppressing diseases. Recognizing these symptoms and the high risk cases, the next question comes up about what happens as this disease progresses. As this disease progresses, in those critical cases, it can cause serious complications, including organ failures leading to intensive care unit care, But in the 82 to 90% patients, with time, the time being anywhere between 2 weeks to 4 weeks, complete recovery is possible, and that is important to remember. There is clearly an interest amongst people to know what kind of medications are being used to treat the coronavirus. As of now, there is no approved drug. However, certain anti-malarial medications, certain anti-HIV medications, and certain antiviral medications are being tried in the critically ill patients with some degree of success. So at this point of time, it's very important for us to take preventive steps and protect ourselves from this virus and protect our loved ones and families from it, because clearly this pandemic is here and it's spreading. There is also a very keen interest on the effect of temperature on the coronavirus, and what is known that it best survives at temperatures below 4 degrees Celsius. And as the temperature keeps rising, the survival of the virus on surfaces around us from where we may get contact transmission reduces down to as little as survival of 15 minutes to a few hours. So it is believed that as temperatures rise and the disease becomes less, the virus becomes less active and can survive less, the number of cases should reduce, and that's good news for us. In the next video, we will see what are the steps that we can take to protect ourselves from the coronavirus in terms of practical responses that an individual or a group can take. And also, we shall see what are the myths surrounding coronavirus COVID-19 infections. Till then, take care, stay safe, be happy, be healthy. See you till next time. Dr. Roy signing off.